New strain of COVID is spreading across the country, and new data from NCDHHS shows cases are on the rise. Looking around, you might actually see more signs from the state about boosters and masking.
But as some take more precautions, it might be harder for others to do the same. WCNC Charlotte's Austin Walker joining us live. Austin, some people are finding out their insurance no longer covers their COVID-19 shots.
Yeah, hey Colin, we've actually been hearing that insurance companies have dropped its coverage on some of them on both the COVID-19 booster and COVID-19 vaccine. Now this means some people might not be able to get the shot they want or desperately need. For some, COVID-19 is like a bad word.
I think people really just want to move forward.
While others have accepted it into the vocabulary.
I've got a degree in biology, so I trust science. But it scares me when so many people don't.
But for the last few months, the virus has been thrown around more and more.
We are seeing an uptick in our emergency department and hospital use as well.
Elizabeth Tilson, State Health Director for NCDHHS, says while there have been an increase in COVID-19 cases, the department is in a much better place to respond than 3 years ago.
The good news is that we're in a very different place with COVID now than we were a couple of years ago.
Tilson says the main reason behind the uptick comes down to waning immunity.
New variants in general can spread a little bit more easily than past variants. That's just the nature of the virus. People are farther away from either their last vaccine or prior infections.
But while we know more on how to prevent infections, it could be difficult for some to do that. NCDHHS says a new booster is being rolled out at the end of September, but some insurance companies are dropping the booster from coverage, making it more difficult for some people to get the shot. CVS Pharmacy telling WCNC Charlotte COVID-19 vaccines are covered under most health insurance plans, but if it is dropped for you, the vaccine and booster is currently available at no cost for uninsured people. That is echoed by Tilson.
There'll still be some supply from the federal government that'll be coming through DHHS.
So while sometimes people want to redact COVID-19 from their vocabulary,
If it comes up again, what am I going to do? I'm going to say, sure, maybe I'll take a couple extra precautions, but I'm not going to stop living.
it's staying around.
If you go back and look at the past couple of years, in the summer, we've had a surge.
So some good news right there. The vaccine is still available at some places if you are uninsured, but Tilson says there's obviously some things you can do besides getting the vaccine. Good health practices still apply. That means washing your hands, sneeze into your elbow, and at worst case worse, if you do feel sick, stay home and take a COVID-19 test. For now, we're live from Uptown. Austin Walker, WCNC Charlotte.